here, you've got fauna aura. I found out about this in Washington, D.C. a few years ago. And to me, it's an example of a brilliant innovation to put the family at the center of care. Again, the old way of thinking is the patient comes in with the lab result. Is that okay? If I go a little over? It's 10 more. Okay, thank you. If the patient comes in with their lab result, that's one way of thinking. Patient-centeredness might mean we think about the patient and maybe all of their lab results and their dental circumstances and their behavioral issues and stress. But really, fauna aura, to me, is the future of healthcare. It's bringing the family together and bringing all the care systems together and saying, we exist for you, and so we'll put you at the center. So here, again, is an incredible innovation that you've got now these families, these patients, think about them and then act for the population. A moment on cost. It's tough. Every country I'm in has got to cut down costs. You can use lean methodologies, you could use patient-centered design, innovative methods. Just cutting cost across the board is probably the worst thing you can do, because what you're going to do is put the same people on the same treadmills without changing process. And we have so much waste in our system. One of my colleagues is Patty Gabbo. She's a physician who leads Denver Health. Denver Health is the public hospital. It's the hospital that takes care of migrant farm workers, underserved, the sickest and poorest people in the state of Colorado. And you could say, well, we take care of poor people, we don't have any waste in our system, or we take care of a population that's stressed, we don't have any waste. But you do. And so Patty said, I'm going to get in there and find it. And her team has reduced expenses using lean methodology by $71 million over the last 5 years, $30 million in the last year. And she said, we're just getting really good at getting better. And so I think if you use lean methodologies and you start to get in and do value stream mapping, we heard some about that yesterday, it'll start to show you where the waste is. There's also a waste identification tool on IHI's website. It's free for all. You can go on there and download a tool that you can use to walk around and see where your waste is on your unit. And then when you aggregate that, that will give you a sampling of quality improvement projects that will help you to drive out waste at the same time you're making improvements in care. So you can go onto ihi.org and download that tool if you like. And here's another way to see waste, and that is to get lean by looking at the patient's journey. So this is a guy, Gilbert, who I met in California a couple of weeks ago. Gilbert is an awesome guy. We're like Facebook and email friends now, and he's taught me so much about healthcare that I can't tell you. Gilbert is 37 now, and about 19 years ago, Gilbert was playing with a handgun, and he accidentally shot himself in the belly, and the bullet lodged in his spine. And I was interviewing Gilbert about his care, and I asked him, I said, Gilbert, tell me about your life. And he calls it life in a chair. He said, you want me to tell you about life in a chair? I said, yeah. So he was telling me about his doctors and nurses. And he said that they are fantastic. He loves his doctors and nurses. And I said, well, why do you love them? And he said, they love me. He said, they love me so much it's comical. He said, when I wheel in there, they know me. They know my preferences. They know my family. They know what I want and need. They know what I like. And they work with me to produce a plan of care. He said they're technically expert, they're caring and warm people. He said, I just can't say enough about the care I get. And then I said, well, what happens when in between visits? And he said, by the time he gets to his car and he's folding up his wheelchair and putting it in the back seat, he said his cell phone rings and all his lab results are on there. His electronic record will send him a post-visit summary, and it will say, the doctor said this and this, the nurse advised this, change your eating habits. But he said the electronic system and the caring people produce a care system that he said is breathtaking for him. And he loves it. And so I was thinking, wow, he's like the perfect patient, you know? All he's saying is wonderful things. I don't know why, but I said, Gilbert, tell me about your chair. And he said, it's the latest hydraulic technology. It only weighs so many pounds. He loves it. And I said, have you ever had a problem with it? And he said, well, when I get a flat tire. Now, I've been in healthcare for 30-something years, and I have to admit here that I never thought about a patient in a wheelchair getting a flat tire. It never crossed my mind. And so I said, well, Gilbert, what happens when you get a flat tire? And he said, I call my primary care doctor. My primary care doctor, will call me back at some point during the day. I tell him I got a flat tire. He writes a prescription for a replacement tire. They send it to the durable medical goods department. The durable medical goods department will kind of go out and search to try and see where they can get a replacement tire. They then buy it. They send it into the office. When it comes in, the office calls Gilbert and tells him, come back in to get your tire changed. And so I said, Gilbert, how long does that take? And he said, 3 weeks. And I said, my God, somebody in the audience said, I got a flat tire yesterday. I called roadside assistance, and within an hour, my tire was changed. Why can't we do that for Gilbert? Nobody knows that Gilbert's tire takes 3 weeks because we're focused on each person doing their job, and we're not looking at the journey. So Gilbert is going to show us where the waste is. So I said to him, what happens during the 3 weeks? And he said, Maureen, sometimes when you get a bad leg, you limp until it gets better. He said, I have to pull really hard on my flat tire side, which of course throws the muscles in his back out, which means he needs to take pain medication, which he hates because he's got a full-time job. So now we've got medication and disability and all kinds of problems because we never saw the 3-week journey. And so while I was on the subject of equipment, I said to him, do you have any other equipment issues? And he said, well, there's the problem with catheters. And he said that he has to catheterize himself because he's paralyzed. And so I said, well, tell me how that all works. And he said he wheels himself into the handicap stall at the hospital where he works, and he catheterizes himself. And I said, how often do you do it? And he said 4 to 5 times a day. And I said, well, tell me the problem with the catheters. And he said, Medicare regulations say you only get 20 catheters a week. And so I was kind of doing the math, and I said, you don't have enough catheters. And he said, I know. He said, what happens is I'm supposed to wheel myself out, and then I wash it off in the sink in the men's room. And he said the guys in the men's room look at him weird and all kinds of stuff. So he said oftentimes I might not do as good a job as I should, and I end up with an infection. And so I said, well, have you spoken to your physician about this? And he said, yes, I did. And he said, the doctor said, there is another alternative. You can microwave it. So he said, I started going up to the employee cafeteria. Yeah, you can imagine, if the guys didn't like it in the sink in the bathroom, they weren't going to like it in the employee cafeteria. So what happened then was, I said to him, well, what happens? And he says, I get infections a certain number of times a year, and they end up with him being hospitalized. That's Gilbert's Waste. Gilbert's telling us, if you looked at my whole journey, then I wouldn't be hospitalized. I'd be saving all that expense. That's a defect in our system that he gets hospitalized. And I said to him, what about your medications? And he said, when he wheels into pharmacy, he said that he gets urinary tract infections so often that there's a shelf called Gilbert's Cipro. And he has his own shelf. Now that's a defect. And when we start to get in and act for Gilbert, you will see the waste in the system. Gilbert didn't tell me this in the beginning. He told me the staff were great, the medical record was incredible. But when we really start to follow patients throughout the journey of their care, they will tell us where the waste is. And that's our responsibility, to get in there. And then finally, just to end up on health. What does health mean? Gilbert told me what health means. Gilbert told me that it means that he can live in his chair without infection. Christian told me that it means he's going to live 6 years longer, and that he's got a chance to live every day of his life. Yesterday we heard about the greatest untapped resources in healthcare. To me, it's the wisdom of patients and families in helping us design care. In Yunchiping County, where Christian lives, they are taking on obesity as a community initiative. It's not just a medical problem. It's not just a school problem. Everybody in the community has come together. There are cooking classes. When I'm there in Yunchiping, I'll be speaking to a room like this of healthcare professionals, leaders, and policymakers. And in the very next room, there'll be an equal number of elderly people who are in there, and they run their own PDSA cycles. They're running improvement. We've taught them how to run improvement projects. And they bring in their weight and their calorie counts on run charts, and they're sharing PDSA cycles, and they're saying, I'll teach you how to cook better. You see that the dentist is checking blood pressures and weights, and everybody takes on this job. My favorite is the walking school bus. So now the school bus drivers go and pick up the students, and they walk them to work. And the students are healthy, and so are the school bus drivers. Because they're walking. Everybody's walking. It's a whole mentality about using improvement methods on a chronic and serious problem, but it's all of our work together. And here, I'm hoping that next time I come back, there'll be patients in the next room, patients in some of these rooms working on improvement projects as well as healthcare professionals. I love Antonovsky's definition. We've been so far living on the disease end of the spectrum, and we really need to start moving to the health ease part of the spectrum. When we start to think about health ease and what's our job in easing health, I think it gives us a whole different method, a whole different way of working. So we need new ways to learn. And to me, the future is right here in the room. You've got excellence everywhere. You've got improvement methods and capability that we'll be building over these next years. You've got incredible commitment. Patients will come and help you, just like Gilbert and Christian have helped me. And together, I think we can start to see, all teach, all learn. We can move the whole system forward when everybody starts to see, I've got something to contribute and I've got something to learn. So my last slide is this one. It's a Japanese print that hangs in the office of IHI. And if any of you do come to Boston, I do hope that you'll come to visit. We love having people come to visit. But the story of this Japanese print is somebody gave it to IHI because they think it kind of represents the journey that we're all on. Here you see two men that are crossing a body of water, and there's a very small, narrow path of land. The person out in front has more risk, right? The person out in front doesn't know what the terrain looks like. So he's closer to the ground, and he's tapping way ahead of him. And he's just saying, how do I find the solid ground? How do I find the right Gilbert or Christian? How do I start my first PDSA cycle? How do I act for one individual and then think about the population? And you can see that his journey is scarier, but the man behind him has more courage, right? He's up a little bit. He's standing higher. He's not in such a risky situation. He's able to follow. Both of these guys need to cross. It's just like all of us in the room need to cross. We need all of you to bend down here at Koawatea and start putting those first kind of little sticks out in front, and then bring everybody else along behind us. So thank you so much for the opportunity to be here with you. I'm just delighted to have this inaugural event with you, and kia ora.